and welcome back to our YouTube channel. Today we are going to be talking about depression, what it is, the common misconceptions, and some statistics to show how severe this problem is. Keep in mind this segment will show over the course of 3 videos, so don't miss out on those when we upload them next week.
We have conducted a simple survey to notice what the public knows about depression, specifically those that have not studied psychology in a very in-depth manner.
So to start, what is depression? Many thought it was a state of sadness, having self-hatred, and being numb either emotionally or physically. One even stated that it was being sad all the time, causing unhappiness in one's life.
However, depression is actually a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression, it affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems.
You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life isn't worth living. And although depression may occur only once during your life, people typically have multiple episodes.
But what causes this mental illness to occur? It's not known exactly what causes depression. As with many mental disorders, a variety of factors may be involved, such as biological differences. People with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes.
There is also brain chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. Recent research indicates that changes in the function and effects of these neurotransmitters and how they interact with neural circuits involved in maintaining mood stability may play a significant role in depression and its treatment.
Hormones also can cause depression. Changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result in pregnancy and during the weeks or months after delivery, postpartum, and from thyroid problems, menopause, or a number of other conditions.
You also have to consider inherited traits. Depression is more common in people whose blood relatives also have this condition, but keep in mind that researchers are still trying to find genes that may be involved in causing depression.
There are also specific disorders that can cause depressive symptoms such as bipolar 1 and 2. These mood disorders include mood swings and range from highs, mania, to lows, depression. It's sometimes difficult to distinguish between bipolar disorder and depression.
Cyclothymic disorder can also cause it. Cyclothymic disorder involves highs and lows that are milder than those of bipolar disorders, but are still extremely impactful.
There is also a disruptive mood dysregulation disorder. This mood disorder in children includes chronic and severe irritability and anger with frequent extreme temper outbursts. This disorder typically develops into depressive disorder or anxiety disorder during the teen years or adulthood.
Additionally, persistent depressive disorder, sometimes called dysthymia, is a less severe but more chronic form of depression. While it's usually not disabling, it can prevent you from functioning normally in your daily routine and from living life to its fullest.
Depression can also be influenced by premenstrual dysphoric disorder. This involves depression symptoms associated with hormone changes that begin a week before and improve within a few days after the onset of your period, and are minimal or gone after completion of your period.
Depression is not a normal part of growing older, and it should never be taken lightly. Unfortunately, depression often goes undiagnosed and untreated in older adults, and they may feel reluctant to seek help.
Symptoms of depression may be different or less obvious in older adults, such as memory difficulties or personality changes, physical aches or pain, fatigue, loss of appetite, sleep problems or loss of interest in sex, not caused by a medical condition or medication, often wanting to stay at home rather than going out to socialize or doing new things, and suicidal thinking or feelings, especially in older men.
Depression often begins in the teens, 20s, or 30s, but it can happen at any age. More women than men are diagnosed with depression, but this may be due in part because women are more likely to seek treatment.
Knowing the severe nature of this mental illness, it is concerning that more people are not seeking proper care and support. However, we hope that our upcoming videos will provide you with the information needed to take the first step on your path of taking care of yourself mentally and emotionally.
If you want to learn more about depression disorders and what it is on the more fundamental level, we will have more statistics and websites linked in a blog post on our website. We will also be posting another video next week going more in depth about this issue.
Please remember that we are not professionals, and if you are dealing with an anxiety disorder or any other mental illness, please seek an adult or physician to confide in.
You can also call the suicide hotline at 1-800-273-8255. Don't be afraid to speak up.